We have 47 new confirmed cases of COVID-19 and 14 new probable cases. There are no additional deaths to report, and we now have 82 reported cases who have recovered. So that gives us a total combined confirmed and probable cases in New Zealand of 708, which is 61 more than yesterday. We have 14 people in hospital with COVID-19, and the locations and details of that will be on our website. 2 of the 14 who are in hospital are in intensive care units, but they are stable. For those cases that we have information on to date, we still see a strong link to overseas travel, with just over half of all the cases reporting overseas travel, as well as links to confirmed cases within New Zealand of 30% and community transmission at about 1%. However, we continue to focus on getting better information on the data for community transmission. I now want to talk about the case definition. As the Prime Minister mentioned yesterday, our technical advisory group met yesterday, and today we will be issuing a new case definition. This case definition is used as a guide for clinical practitioners for diagnosis and testing. But we do rely on clinical judgment at all times for any assessment of any patient. The new case definition is now anyone with respiratory symptoms which are consistent with COVID-19 disease. Those individuals should be considered for testing regardless of travel history or contact with a confirmed case. We do know that this will result in more testing being done, which is good, and which we are also prepared for. Our testing capacity is currently 3,700 tests, and we are currently doing an average 1,843 tests per day based over the last 7 days. We are increasing our capacity to test as well. We currently have 8 laboratories who are testing, and by the end of next week we will have 10 laboratories who are able to test, and that will bring up our capacity further. On clusters, we continue to actively investigate and contact trace a number of clusters. Clusters are defined as outbreaks, so there are cases which appear to be connected. And one of the reasons that we focus on clusters is that we want to make sure that we don't get spread of those clusters. So we identify, test, isolate, and investigate. And that investigation happens at a local level through our district health boards. And it starts off with a case interview, followed by identification of who their close contacts would have been. And each situation is variable, depends on the nature of the movements of the case. And so it can mean that we have more testing at a local level, according to the local medical officer of health. And the purpose there is to get good control of spread, but also it allows us to get better information about what is actually happening in that community. Our contact tracing continues. Yesterday we were in contact with 418 close contacts to give them advice and information about the need for strict, monitored self-isolation for 14 days. And lastly, I just want to emphasise that what we are talking about is physical distancing, not social distancing. So it's really important that we do all keep in contact by phone and through the various options that we now have for networking. It's important that we remind people to be considerate to each other and to your neighbours and to be kind.
So I'd like to start with a bit of a shout out to our sign language interpreters today. And I'd like to thank them and the other sign language interpreters that have been working so hard in recent weeks at these media conferences. They are providing an essential service, ensuring that deaf people can access this important COVID-19 information along with other New Zealanders. So thank you. I'd like to recognise the role that Māori continue to play in the emergency responses, and we know from recent emergencies including the Whakaari, White Island eruption, the Christchurch mosque attacks, and of course the Kaikoura earthquake and tsunami and Canterbury earthquakes as well, iwi and Māori are a key part of any response, and they are connected across all levels of the COVID-19 response that is being undertaken. Civil Defence Emergency Management Coordination Centres at a regional level have iwi liaison embedded to contribute to the response effort and to leverage their significant community networks. Iwi and Māori organisations are mobilising across the country to support their communities and to help stop the spread of COVID-19. To support these efforts, the government last week announced a $56.5 million package to support a whole-of-government approach to providing health, social and economic support to meet the specific needs of Māori. This includes $10 million to support community outreach being distributed to iwi Māori groups and communities across the country, and $15 million to support whānau ora commissioning agencies in their work with whānau. I thought it would be useful to update you about the charter flight that started to take New Zealanders who have recently returned from overseas back to their regional centres. The first flight took 57 passengers from Auckland to Wellington and then on to Christchurch yesterday. These people have been in managed isolation in Auckland hotels since coming back from overseas, and we have another flight this afternoon, and there will be more in the coming days as needed. We are doing our best to move people who are eligible for these chartered regional flights as soon as we can. All passengers on these flights had pre-health checks and were without COVID-19 symptoms. They must all go into self-isolation once they get off the flight. It's been a very complex exercise to make these flights happen, and it's just one example of the tremendous work being done by national and local government working alongside the private sector. Yesterday, the Minister of Civil Defence extended the state of national emergency for a further 7 days. The Minister has extended the state of national emergency to ensure we continue to have all of the resources, support and powers we need to prevent the spread of COVID-19 in our communities. Under the Civil Defence Emergency Management Act, a state of emergency expires after 7 days after it's declared, unless it's extended or terminated earlier. The 7-day limit is a safeguard, as the powers made available to me as Director and to local controllers are far-reaching and are only needed when we're dealing with an emergency. States of emergency can be extended as many times as needed, but each week we will be applying a stringent check to make sure that we do still require those powers and we meet the tests that are set out in the Act. I'm aware that some people have been confused about the difference between a state of national emergency and COVID-19 alert levels, so I'll try and explain. The state of national emergency and COVID-19 alert levels are two distinct and separate things. The alert levels specify the range of measures that we are taking against COVID-19. A state of national emergency provides the people managing the response in an emergency, and in this case COVID-19, to access powers that they need but would not normally have. The alert levels can be applied without a state of emergency, and a state of emergency can be declared without alert levels being used. However, the powers made available by the state of emergency do support and help us enforce the measures being applied. The powers have been used a number of times so far, including to stop people doing non-essential activities and to requisition a car park so it can be used as a community-based assessment centre. These powers are complementary to the powers under the health legislation. We can reiterate the importance again of staying home saves lives. The message is simple, and you've heard it from me and others before. We're all in this together. Most New Zealanders are continuing to stay at home and help keep everyone safe, and we know and recognise we're asking a lot of New Zealanders when it's challenging, and we thank you for your continued efforts. We're aware that in some communities there's been expressed concerns about the welfare of their residents, and some have taken steps to express their concerns, including signs or road obstructions to prevent travel in or through their area. Where police are aware of these, they have been speaking to those involved and have provided education and advice to ensure the safety of all members of our communities. The police focus remains on maintaining public safety, security and public order, and everyone can assist by continuing to self-isolate in their own home. Please do get outdoors for some fresh air and exercise, but do stay local. Travel should be restricted to that essential travel and for people to buy food or medical supplies. So finally, I'd just like to say again, thank you to everyone for everything you're doing to help us break the train of transmission.